Your doctor says, drink in moderation, but never explains that your diabetes medication could turn one glass of wine into a medical emergency. I'm talking about the hidden interaction that most doctors don't warn you about, the one that can drop your blood sugar so low you don't wake up, or spike it so high you end up in the ER. Here's what happened to Sarah, a 52-year-old teacher from Ohio. She'd been managing her type 2 diabetes perfectly for 3 years, her A1C under control, taking her metformin religiously, following all the rules. One Friday night, she had 2 glasses of wine with dinner. Nothing crazy. She'd done it before. But this time, she woke up at 3 a.m. drenched in sweat, heart racing, barely able to think straight. Her blood sugar had crashed to 41. What her doctor never told her? The combination of metformin, alcohol, and the timing of her meal created a perfect storm. She was lucky her husband found her. Most people with diabetes think they know how to drink safely. Check blood sugar, eat some food, don't go crazy. But that's not enough, because drinking with diabetes isn't just about blood sugar. It's about how alcohol interacts with every medication in your system. And those interactions, they can be deadly. Today, I'm going to show you the complete protocol for drinking safely with diabetes, not the generic advice your doctor gives everyone. The real step-by-step system that accounts for your medications, your specific situation, and the hidden dangers no one talks about. We're covering the 3 most dangerous medication interactions that can kill you, the exact 7-step protocol I use with my patients, and how to implement this in your real life without becoming a hermit. But first, let me show you why the standard advice is so dangerous. By the way, if you're watching this and you're on insulin or sulfonylureas like glipizide, what I'm about to share in the next section could literally save your life. So stay with me. Here's the truth most doctors don't tell you. Alcohol doesn't just affect your blood sugar, it hijacks your liver, and when your liver is busy processing alcohol, it can't do its other job, keeping your blood sugar stable. But it gets worse when you add diabetes medications to the mix. If you're on insulin, alcohol creates what I call the delayed death trap. Here's what happens. You drink, your blood sugar might actually go up initially from the carbs in your drink. So you think you're fine. You might even take your normal insulin dose. But 6 to 12 hours later, when the alcohol is still in your system, your liver stops releasing glucose. Your insulin is still working, but now there's no backup glucose coming from your liver. Your blood sugar crashes. Hard. The scary part? This happens while you're sleeping. You don't feel the warning signs. No sweating, no shaking, no racing heart. You just don't wake up. This is why emergency rooms see a spike in diabetic emergencies on weekend mornings. People who thought they were being careful. Now, if you're on sulfonylureas, that's medications like glipizide, glyburide, or glyburide. Alcohol becomes even more dangerous. These medications force your pancreas to pump out more insulin. Add alcohol, and you get what doctors call the double whammy effect. Your medication is pushing insulin out, alcohol is blocking your liver's safety net, and your blood sugar can drop so fast and so low that even glucose tablets can't save you. I had a patient, Mike, who was on glyburide. He had 3 beers watching a football game. 8 wings, thought he was being smart. 4 hours later, his wife found him unconscious on the couch. Blood sugar was 28. The paramedics said if she'd found him an hour later, he wouldn't have made it. But here's the one that really gets me. Metformin seems harmless, right? It doesn't cause low blood sugar on its own, so people think it's safe to drink with. Wrong. Alcohol plus metformin can cause something called lactic acidosis. It's rare, but when it happens, it's often fatal. Your body starts producing too much lactic acid, your blood becomes acidic, and your organs start shutting down. The warning signs? Nausea, vomiting, stomach pain, muscle pain, trouble breathing. But here's the problem. Those are also hangover symptoms, so people ignore them. Now, I know what you're thinking. This sounds terrifying. Should I just never drink again? The answer is no. You can drink safely with diabetes, but you need to follow a specific protocol. And if you want more life-saving diabetes content like this, hit that subscribe button and the notification bell right now. I'm going to show you exactly how to do it, step by step, starting right now. All right, here's the system that's kept my patients safe for over a decade. I call it the 7-step safety protocol. Follow this exactly, and you can drink without the fear. Step 1. The pre-drinking assessment. Before you even think about having a drink, you need to check 4 things. First, your blood sugar. It needs to be between 100 and 180. If it's below 100, eat something and wait. If it's above 180, skip the alcohol entirely. Your body is already struggling to manage glucose. Second, when did you take your last medication? If you're on insulin, you need at least 2 hours between your last dose and your first drink. For sulfonylureas, make it 3 hours. This gives your medication time to peak and start coming down. Third, when did you last eat? Never, and I mean never, drink on an empty stomach. Your last meal should be no more than 2 hours ago, and it should include protein, fat, and complex carbs. Fourth, how are you feeling? Stressed, tired, or sick? Skip the alcohol. Your body needs all its resources to manage your blood sugar. Step 2. The strategic eating plan. This is where most people mess up. They think eating anything before drinking is enough. It's not. You need what I call the safety buffer meal. Here's the formula: 20 to 30 grams of protein, 15 to 20 grams of healthy fat, and 30 to 40 grams of complex carbs. Why this combination? The protein slows alcohol absorption. The fat delays gastric emptying, giving your body more time to process everything. The complex carbs provide steady glucose release to counteract alcohol's liver effects. Good options to eat: grilled chicken with avocado and quinoa, salmon with sweet potato and olive oil, even a turkey and cheese sandwich on whole grain bread works. Timing matters too. Eat this meal 30 to 60 minutes before your first drink, not while you're drinking. Step 3. Drink selection strategy. Not all alcoholic drinks are created equal when you have diabetes. Safest options: dry wine, light beer, or spirits mixed with sugar-free mixers. These have the lowest carb content and won't spike your blood sugar on top of everything else. Avoid like the plague sweet wines, regular beer, cocktails with fruit juice, anything with simple syrup. These are blood sugar bombs that make everything worse. Here's my go-to recommendation: vodka with club soda and lime. 0 carbs, clean alcohol, easy to track, and portion control is critical. 1 drink per hour, maximum of 2 drinks total if you're new to this protocol. A drink is 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of spirits. Quick question: pause the video and check. Are you on any of the medications I mentioned? Insulin, sulfonylureas, or metformin? Because what I'm about to share next is specifically for you. Step 4. The monitoring protocol. This is non-negotiable. You need to check your blood sugar every hour while drinking, and every 2 hours for the next 8 hours. Here's your action plan based on the numbers: 70 to 100. Eat 15 grams of carbs immediately. Recheck in 15 minutes. 100 to 180. You're in the safe zone. Continue monitoring. 180 to 250. Stop drinking. Drink water. Check for ketones if you're type 1. Above 250. This is an emergency. Stop drinking. Call your doctor. If you have a CGM, set alarms for 80 and 180, but don't rely on it completely. Alcohol can affect accuracy. Finger stick every few hours to confirm. Step 5. The buddy system. Never drink alone, ever. Your drinking companion needs to know 3 things: you have diabetes, what low blood sugar looks like, and where you keep your emergency supplies. Give them this script. If I seem confused, sweaty, or can't speak clearly, give me glucose tablets or juice. If I'm unconscious, call 911 immediately and tell them I'm diabetic. Keep glucose tablets in your pocket, not your purse or bag. If you're unconscious, someone needs to find them fast. Step 6. The Sleep Safety Protocol. This is where most emergencies happen. You feel fine when you go to bed, but alcohol is still working in your system. Your bedtime blood sugar should be between 140 and 180. Higher than normal, yes, but alcohol will bring it down overnight. Set an alarm for 3 a.m. Check your blood sugar. If it's below 100, eat 15 to 30 grams of carbs and stay awake until it comes back up. Keep glucose tablets, juice, and crackers on your nightstand, not in the kitchen, right next to your bed. Step 7. Next day recovery. Your blood sugar will be unpredictable the next morning. Check it as soon as you wake up. If you're on insulin, you might need to reduce your morning dose by 10 to 20%, but check with your doctor about this ahead of time. Don't guess. Drink plenty of water, eat a balanced breakfast, and monitor closely for the first 24 hours. Alcohol can affect your blood sugar for up to 24 hours after your last drink. Now, this protocol works, but only if you can actually implement it in real life. And let's be honest, real life is messy. So let me show you how to make this work when you're at a wedding, traveling, or dealing with peer pressure. Look, people are going to pressure you to drink more. They don't understand diabetes, and they think you're being dramatic. Here's what works. I'm on medication that doesn't mix well with alcohol. 1 drink is my limit. Most people will back off. If they don't, they're not people you want to be around anyway. At restaurants, order first. Get your safe drink before anyone can influence you. Ask for your mixer on the side so you can control the ratio. At parties, bring your own drinks. Seriously, a small cooler with light beer or diet mixers gives you complete control. Traveling messes with everything. Time zones, meal schedules, stress levels. Here's how to handle it. Pack extra supplies. Glucose tablets, test strips, backup meter. Airlines lose luggage, but they can't lose what's in your carry-on. Adjust your protocol for time zones. If you're drinking at 8 p.m. local time but your body thinks it's 11 p.m., treat it like an 11 p.m. drink. Your medications are still on home time. For weddings and holidays, eat the safety buffer meal before you leave home. Don't rely on event food timing. Use your phone. Set alarms for blood sugar checks. Most people ignore them in social situations. Don't be most people. Apps like My Sugar or Glucose Buddy can track your numbers and remind you to check. Use them. If you have a CGM, share access with a family member. They can monitor you remotely and call if something looks wrong. The I feel fine trap. Alcohol makes you feel confident and relaxed. That's not the same as being safe. Check your numbers, not your feelings. Overconfidence after success. Just because you drank safely once doesn't mean you can skip the protocol next time. Every time is different. Ignoring medication changes. New prescription, different timing. The protocol might need adjustment. When in doubt, ask your doctor. The just this once mentality. There's no such thing as just this once with diabetes. The protocol works because it's consistent. I know this seems like a lot, and maybe you're thinking, is it even worth it? Here's what I tell my patients. You're not giving up alcohol forever. You're learning to drink smarter than 99% of people with diabetes. And that knowledge, it could save your life. If this information has been helpful so far, do me a favor and hit that like button. It helps more people with diabetes find this content when they need it most. Here's the bottom line. Drinking with diabetes is possible, but it requires respect for the process. The 3 most important things to remember. Know your medication interactions, never drink alone, and always have a plan for low blood sugar. This isn't about living in fear, it's about living smart. Following this protocol means you can enjoy social situations, celebrate special occasions, and still wake up healthy the next morning. But here's what I want you to do right now. Screenshot the 7-step protocol, save it to your phone, share it with someone who drinks with you regularly. And if you're on any of the medications I mentioned, insulin, sulfonylureas, or metformin, talk to your doctor about this video. Show them the protocol. Get their input on your specific situation. If this video helped you understand something new about drinking with diabetes, hit that like button, subscribe, and ring the notification bell so you don't miss the follow-up. Next week's video about handling peer pressure when you have diabetes could save you from making a dangerous decision at your next social event. And here's my question for you. What's your biggest concern about drinking with diabetes? Is it the medication interactions, the blood sugar monitoring, social pressure? Let me know in the comments. I read every single one, and your questions help me make better content. Remember, you don't have to choose between having diabetes and having a life. You just have to be smarter about how you live it.